So, have you ever heard about hyperbaric oxygen therapy and maybe wondered, what the different kinds actually are?
Yeah.
We're going to take a detailed look into that today. We'll be using some really crucial info from expert groups like the Undersea and Hyperbaric Medical Society
Hmm.
and the South African Underwater and Hyperbaric Medical Association.
Yeah, and our goal for this deep dive really is to try and clearly separate, what's considered standard hyperbaric oxygen therapy
Right.
from this other treatment you often hear called mild hyperbaric oxygen therapy. We want to focus on what they're actually used for
Yeah.
and the safety stuff too.
Okay.
Based on what these groups and the U.S. Food and Drug Administration say, it should hopefully give some real clarity if you're maybe thinking about these treatments or just want to understand them better.
Absolutely. And we'll be digging into the official statements from both the Undersea and Hyperbaric Medical Society and that South African group,
Yeah.
plus information from the Food and Drug Administration, the FDA, and the American Medical Association. So maybe start us off. What actually is hyperbaric oxygen therapy, like at its core?
Okay, so fundamentally, hyperbaric oxygen therapy means breathing oxygen that's, well, very close to 100% pure
Yeah.
while you're inside a chamber that's pressurized.
Right.
Now, the Undersea and Hyperbaric Medical Society, they have a specific definition. They say for it to be therapeutic hyperbaric oxygen therapy, the pressure has to be equal to or more than 1.4 atmospheres absolute, or 1.4 ATA.
Okay, 1.4 atmospheres absolute. And just for context, 1 atmosphere absolute is just normal air pressure, like at sea level?
Exactly. So 1.4 is, about 40% higher pressure than just sitting here right now.
Got it. And it's interesting because the South African Underwater and Hyperbaric Medical Association, they seem to set the bar even higher for the medical uses they approve.
That's right, yeah. The South African group specifies that for their approved medical uses, the therapy needs to start at a pressure of 2.0 atmospheres absolute, or even higher.
2 point.
They believe that higher pressure is really needed to get the therapeutic effects for the specific conditions they recognize.
Okay. Now, this seems to be where that other term comes in, mild hyperbaric oxygen therapy. What makes that different?
Well, mild hyperbaric oxygen therapy, or MHBOT as it's sometimes called, usually involves chambers made out of, like, fabric, and they operate at lower pressures.
Lower. Hold on.
Generally at or below that 1.4 atmospheres absolute mark we mentioned earlier.
Yeah.
You often see these marketed maybe for sports recovery or in alternative medicine circles.
Right. And it sounds like the regulators, like the Food and Drug Administration in the U.S., have a very specific take on these fabric chambers.
They do. The FDA has cleared these low-pressure fabric chambers, yes,
Mhm.
but, and this is a big but, it's only cleared for treating acute mountain sickness, nothing else.
Just acute mountain sickness.
And critically, these chambers are designed to be pressurized using just regular air, not with extra supplemental oxygen.
Ah, that seems really important. So
Right.
you're saying the FDA doesn't want people using extra oxygen tanks with these zippered bag type chambers?
And precisely. The FDA actually prohibits using supplemental oxygen with these specific fabric chambers.
Yeah.
There are serious safety risks, think fire, even suffocation, especially if they're used in ways that aren't aligned with the FDA's clearance just for acute mountain sickness using air.
Wow. Okay, so that's a major safety point.
Definitely. It's down to the materials and how they're built. They aren't intended for high oxygen concentrations.
Okay, so let's recap the comparison. We've got standard hyperbaric oxygen therapy, higher pressure, nearly pure oxygen, then mild, lower pressure, regular air. How do they stack up in terms of what they actually do in the body?
Well, when you look at the pressure levels and the oxygen you're actually breathing, the differences are pretty stark. Standard therapy for the conditions approved by the main societies typically uses pressures of 2.0 ATA or higher,
Right, the higher level.
that combined with breathing nearly 100% oxygen. Mild therapy, on the other hand, is 1.4 ATA or less and uses regular air. So yeah, fundamental differences in both pressure and oxygen concentration.
And what's the real world effect of just breathing normal air at those slightly higher but still low pressures in the mild chambers? Does it do much?
Well, according to both the Undersea and Hyperbaric Medical Society and the South African group, breathing normal air at those lower pressures, like 1.4 ATA or less, it delivers basically no more oxygen to your body tissues than if you're just sitting at sea level breathing supplemental oxygen through a standard mask.
Really? So no significant oxygen boost compared to just using a mask?
Not in the way these organizations consider therapeutically meaningful for their approved conditions, no. The slight pressure increase with just air isn't enough to drive significantly more oxygen into the blood and tissues for those purposes.
So based on what these expert groups say, If you're below that pressure threshold, 1.4 for one group, 2.0 for the other, and you're just breathing air, it doesn't really count as the kind of hyperbaric oxygen therapy they recognize for medical treatments.
That's exactly it. Exposure to pressures below 1.4 ATA, per the Undersea and Hyperbaric Medical Society, or below 2.0 ATA, according to the South African Underwater and Hyperbaric Medical Association, while just breathing normal air.
Well, it
Well,
just doesn't meet their definition of therapeutic hyperbaric oxygen therapy.
okay.
It doesn't hit the required oxygen levels or pressures they've established as necessary for the medical conditions they actually endorse treatment for.
Right, which naturally takes us to the really key questions. What is this therapy actually approved for, and what are the safety rules?
Okay, good question. So all the currently approved medical conditions for hyperbaric oxygen therapy, the ones recognized by both the big societies we've mentioned?
They all require breathing nearly 100% oxygen at a minimum pressure. Now, even though the Undersea and Hyperbaric Medical Society definition starts at 1.4 ATA, they specify that all currently approved uses need at least 2.0 ATA.
Ah, okay. So even their approved uses start at 2.0 ATA in practice.
Correct. And the South African group, as we said, they're very clear. Their approved uses start at 2.0 ATA. And it's worth repeating, those soft fabric chambers, only FDA cleared for acute mountain sickness with air.
Got it. And what about safety, specifically with those fabric chambers if someone tries to use oxygen?
Well, the Undersea and Hyperbaric Medical Society, the American Medical Association, and the FDA have all raised red flags about using those zippered fabric chambers with oxygen, especially if it's happening outside of the proper guidelines.
Because of the fire risk.
Exactly. Fire risk and even suffocation risk. It's a major concern when you introduce high concentrations of oxygen into chambers not designed for it, without the right safety systems.
So it sounds like for the standard therapy, there's a recommendation for different kinds of chambers entirely.
Absolutely. Groups like Hyperbaric Aware, they strongly recommend using hard-sided medical-grade chambers. These are built to handle much higher pressures, typically 1.5 up to maybe 5.0 atmospheres absolute.
Much higher.
Yeah. And crucially, these treatments happen in proper facilities, staffed by trained physicians and technicians who supervise everything. That's key for safety and making sure the treatment is right for the patient's condition.
And it's not just the chamber itself, is it? That medical supervision seems vital.
Oh, incredibly important. The Undersea and Hyperbaric Medical Society is very specific. They recommend a physician prescribe the therapy and oversee the entire treatment course for standard HBOT.
Okay.
Similarly, the South African group insists that facilities providing medical hyperbaric treatments over 1.1 ATA must be accredited by them. This ensures they meet strict safety and operational standards. You need that medical oversight to assess if someone's suitable, manage risks, and track if it's working.
What about people thinking they can just, do this at home, buy a chamber online maybe?
Yeah, you hear about that. But both the Undersea and Hyperbaric Medical Society and the South African group are very clear. They do not endorse in-home hyperbaric therapy.
Not at all.
No. Probably because it's just too complex to run safely without professional oversight. You need that medical supervision, and things could go wrong. Plus, remember, the FDA classifies these chambers as Class 2 medical devices.
Meaning?
Meaning you legally need a physician's prescription to get one and use it.
Right. Okay. Now, we've talked about the approved uses, acute mountain sickness for the mild ones, specific conditions for the standard ones. But what about all those other claims you sometimes see? People marketing mild therapy for, I don't know, all sorts of things.
Yeah, that's a tricky area. The Undersea and Hyperbaric Medical Society considers marketing and using those low-pressure fabric chambers for anything other than acute mountain sickness to be off-label use, outside their recognized scope.
Off-label. Okay.
And the FDA has put out warnings, too. They state pretty clearly that hyperbaric oxygen therapy, generally speaking, has not been proven to cure conditions like cancer, Lyme disease, autism, or Alzheimer's disease.
So, lots of caution there.
Definitely. The advice from the FDA is always talk to your actual healthcare provider to get proper medical care for whatever health issue you have. Relying on unproven stuff can mean you miss out on treatments that do work.
Makes sense. It also sounds like there are pretty strict rules about how these chambers, the proper medical ones anyway, should actually be built and run.
Yes, absolutely. The Undersea and Hyperbaric Medical Society really emphasizes that hyperbaric chambers must be constructed, operated, and maintained following current safety codes and standards. They point to things like the National Fire Protection Association codes and a specific standard called ASME PVHO1.
Which is?
It stands for Pressure Vessels for Human Occupancy. Basically rules for building safe pressure chambers for people. and the South African group agrees. They require chamber construction to meet at least category third of the South African standard, SANSUI 47, and also the relevant ASME PVH01 standards. This makes sense, given their approved treatments start at that higher 2.0 ATA pressure. It's all about ensuring patient safety inside the chamber.
Okay, this has been really informative. So if we were to boil it down, what are the absolute key differences you want people to take away from this deep dive?
I think the main things are standard hyperbaric oxygen therapy, the kind approved by the major societies for specific medical conditions, involves much higher pressures, usually 2.0 ATA or more, and breathing nearly 100% oxygen.
Okay. Higher pressure, pure oxygen.
Right. Mild hyperbaric therapy uses lower pressures, 1.4 ATA or less, with just normal air, and it's only cleared by the FDA for acute mountain sickness. They're fundamentally different treatments, different pressure, different oxygen, different recognized uses.
And it really sounds like the big medical authorities, UHMS, SAUHMA, FDA, AMA, they all have pretty significant warnings about using that mild therapy for anything other than acute mountain sickness.
They absolutely do. They consistently point to the lack of solid scientific evidence for other uses, and they highlight those potential safety risks, especially if someone tries to add supplemental oxygen to devices that aren't designed or approved for it.
So the bottom line then, if someone listening is considering any kind of hyperbaric oxygen therapy,
The absolute most important step is to talk it through thoroughly with your own healthcare provider. Discuss your specific medical situation.
right.
They can help figure out the most appropriate evidence-based treatment for you. And if standard hyperbaric oxygen therapy is recommended for an approved condition, they can make sure it happens in a safe, accredited facility with proper medical supervision. That's how you ensure you're getting care that follows established medical guidelines.
That provides a huge amount of clarity. Thank you. Hearing these clear distinctions and the safety guidelines, it really makes you wonder, what further questions do you, listening now, have about how pressure and oxygen levels really impact the potential benefits? And thinking more broadly about alternative therapies, where else do we really need that rigorous scientific check to confirm both effectiveness and safety for people?